So when you're busy in the clinic, going from patient to patient, how often are you truly sitting back and respecting the expertise that sits in front of you in the form of the patient? The patient's the only one who's got the expertise of knowing exactly their own pain condition, how it feels to them, how they experience it, how they think about it, and how they've had to navigate a challenging journey leading up to your clinical encounter. This week, we're going to have the privilege of hearing the expertise of someone who successfully navigated their own pain journey. Tom Bowen's a patient advocate who's been doing some great things. He has a website and a Facebook group, which we'll link in the show notes. In this episode, Tom's going to share what he found helpful in his pain journey and what he didn't feel helpful in his pain journey. And he's going to offer some suggestions to those of you who might be listening, both as a clinician and as a patient, for some ways that maybe when you're struggling with pain, some different ways of approaching it. I hope you enjoy the episode.
This is the Modern Pain Podcast with Mark Cardula.
Welcome to the podcast, Tom.
Oh, thank you so much for inviting me. It's an honor to be here.
It has been far too long on this podcast since we've had somebody who's walked in the patient's shoes discussing some things with us. I think further evidence that the voices that need to be at the table aren't always at the table as much as we should have them. And I think that's one of the big pushes for this podcast is to bring the patient voice back to healthcare. And we're happy to have you on the podcast today. I think having followed you on your Chronic Pain Champions website, I recently got involved in your Facebook group, which you're doing some good things. I love getting in those type of Facebook groups because it's, and we'll link some of that stuff for maybe some folks. I don't want to flood your Facebook group with folks who might not belong. Obviously, you screen folks appropriately, but can you tell folks a little bit about your background before we get into the discussion today, Tom?
Well, my professional background or my personal background, I'm married. I've been married for 40 some years. Prior to retirement on disability, I worked in marketing and advertising, and my last stint was 20 years at Principal Financial Group here in Des Moines in their marketing area.
Nice. What about, and folks can listen or read and kind of get a little bit about your journey. You've done some great publishing articles in various avenues. I've seen some of your work on your website and elsewhere. Can you give folks a little bit of kind of your journey? You don't maybe is what as much as you feel you want to. We want to. I know it's a pretty complex journey as far as you've had a couple bouts with the Mayo's Pain Rehabilitation Clinic and done some amazing things there. But I'm just curious if you can let folks know a little bit of background of kind of your journey with pain.
Sure, I'll give you the Reader's Digest version. My pain journey started January 2009, and it happened when I had I'll be quite blunt, some pain in my testicle, and my testicle is very swollen. Went to the emergency room. The doctor said, well, it might be torsion, it might be infection. I was 50 years old at the time. Said it might be torsion, it might be infection, but you're 50 years old, so I'm leaning towards infection. And so we'll give you some antibiotics and let me know if it doesn't improve. The next week, a few days later, my pain was still there. Called the doctor, got in to see him, did an ultrasound, found out my testicle was torsed. So they had to do an orchiectomy at that point on one testicle and orchopexy on the other testicle. And I'm not sure which one of those procedures caused it, but I ended up with some nerve damage after the surgery.
Can you kind of let folks, like, kind of with some of the journey you've went as far as through healthcare? Because I know some of the discussions you've had online and a little bit as far as some of the struggles with the strict biomechanical type approach to your situation. And then you eventually, sought the help of the Pain Rehabilitation Clinic over there at the Mayo Clinic, where obviously it's a more holistic, multidisciplinary biopsychosocial approach. I'm just curious if you can kind of recount a little bit about, your experiences with maybe both sides of that coin.
Okay, yeah, sure. Well, I was surprised that the pain, I figured I'd have some post-surgical pain. The pain never just went away. And, I went to the doctor hoping to be fixed from that pain. And, I think they tried all sorts of different types of medicines. I went through physical therapy. Um, so I tried all those things, but the pain wasn't going away. So I actually was doing some research on my own because pain is a powerful driver. And I was doing some research on my own. I saw that there was a surgery called denervation that was being offered around the country. And I had actually checked, no one in my area was doing it or in our state, even at our university hospital. So I found a doctor in Chicago. I live in Des Moines, Iowa. Found a doctor in Chicago who offers a surgery where they'll go in and remove nerves out of your groin to help with the groin pain. Makes sense, right? Remove the nerves and you're not going to have the pain. So went to the doctor, actually had the surgery, pretty risky surgery, but the pain went away for a while, but it came back. So I tried injections. I tried radio frequency ablation. I can't remember all the technical terms, all sorts of interventions for it. So I tried surgery. I tried the medications, and none of it was working. And I was actually contemplating going to another doctor, and this time in Washington, D.C., that I had found on the internet to have a similar denervation surgery, thinking that it's probably, maybe it was the surgeon just didn't do it right or something, because I was very tied to the biomedical model. So I was thinking, okay, so another doctor, give me a different result, a different doctor, different result. So I actually flew out to Washington, D.C. one day. I put together this big binder for this doctor, sent it to him beforehand, went to this doctor and talked with him about my pain and my situation. And he said, yeah, we could do that. And it would require 2 surgeries, one on each side of your groin. And we can do that for you. About the same time as that, Mark, I had a perforated colon, which is emergency surgery. And it was prior to that, the emergency surgery, but I was still following up with the surgeon. And so my family doctor also at the time found the Mayo Clinic Pain Rehabilitation Center and recommended I go there. And I really wanted to have the surgery done. My wife wanted me to go to the Mayo Clinic program. And in my follow-up with the surgeon for my colon, I thought, okay, this is going to be an easy deal. I'll just ask the doctor. I'll ask the surgeon, should I have the surgery or go to the Mayo Clinic program? So I asked him, and his response was, Tom, what caused your pain in the first place? I said, surgery. He said, Tom, why would you have another surgery? Go to the Mayo program. So that's when I went to the Mayo program in 2012. 3 years later, after searching for an answer, I went to the Mayo program. And the Mayo program was completely different. We didn't talk about specific pain conditions. There was no specific treatment for my pain that I thought was causing the pain. It was more about just learning about pain. And it was the first time someone told me the difference between acute pain and chronic pain, and learning about pain and learning how to adapt to it.
Yeah, no, it's I've been fortunate enough. I had a stint where I worked at the Mayo Clinic in Phoenix and was able to see our pain rehabilitation program there do some amazing things, and they continue to do it day in and day out. So applaud the work they do over there. I'm curious because you've kind of recounted a bit of your kind of, the medical journey a bit. I'm just curious if you could share with folks some of the, the psychological journey that you go through when you're going through some of this distressing stuff and you're not maybe getting that answer and that, the fix that sometimes, understandably we're going to look for when we're having a painful issue. I'm just curious if you can share with people kind of the journey you had to go through, kind of psychologically, mentally, the understandable things folks go through when they're going through this kind of confusing, time.
Well, it's very frustrating. It's very frustrating because, I mean, you learn when you're a child, from the time you're a child, if you hurt, your mom puts on a Band-Aid, kisses it, and you get better, right? Or you go to the doctor, and the doctor gives you some medicine. You take an aspirin, it gets better. So it's frustrating because you're expecting to get fixed and you don't get fixed. So it gets very frustrating. Um, to me, it was, and thinking back, it wasn't the pain that was so bad for me. It was the, like you said, the emotional responses to the pain. And that was what was worse for me than the pain itself. I mean, the pain hurt, but it was the emotional responses. One thing I think that, going back into that situation, what drove my pain is I was very, I was convinced that the pain was the doctor's fault. That doctor was to blame for my pain. And so my thought was medical malpractice. I'm going to sue that doctor because that doctor created this pain, created this situation for me. And all that anger that I had and blame. Now, this is thinking back, at the time that made sense, but thinking back, all that anger and blame only made the situation worse and worsened my whole pain experience.
Yeah, I mean, understandably, extremely challenging. And you discuss how, at the time when you're in the midst of it, and having had the privilege of speaking with some folks who've gone through some similar challenging times, they've all kind of recounted, like, in the midst of it, it's hard to kind of see, now that you can take that 10,000 foot view looking back. I mean, you've been able to recognize some things, and I'm sure, folks at Mayo probably maybe helped you process some of those things a bit. But do you feel like sometimes there's that kind of, because we'll see folks with workplace injuries and, post-surgical things and different things. Is that sometimes, something you think that can be a common issue with some folks struggling with persistent pain? You obviously work and maybe counsel and support a lot of folks who are dealing with some things. In your experience, do you see some folks who are dealing with some things of being very angry, frustrated with, and maybe rightfully so? I'm not by any means discounting the folks' anger, but do you think that's something can be a common thing you see that might be a barrier to somebody moving forward with pain versus getting locked in that struggle where I got to find someone to fix it, and until this right is wrong or this wrong is righted, I can't move forward? I mean, what's your experience with that?
Most definitely. Emotions play a big role. I'm a big believer that pain is inevitable, but suffering is optional, and I promote this all the time. Pain is something that happens to us. Suffering is something we choose to do, and we can choose not to be angry. We can choose to not to place blame. We can choose not to let the stress bother us as much. So we can choose not to be helpless, and we can take an active role in our own pain management. And I think, yeah, the emotions play a big role, but I think that's something that also we have a role to play in. We can't change. I can't go in and change my physiological features or biological features, but I can change how I react to the pain.
Yeah. Yeah. And that is a major mindset shift. As far as you've mentioned, kind of the approach you had. And I think I see that working with a lot of folks who are dealing with some persistent pain issues, is that, this learn to live and move forward with it versus I don't live or move forward until it's gone, it's fixed, it's eradicated. We have a healthcare system that still kind of puts people in that kind of struggle with, constantly discussing what's your pain, where's your pain, and everything that they do in, pain treatments and different things is always, you're getting bombarded with your number. And I sometimes think people get locked in this battle we put it in front of patients constantly. This whole pain is the next vital sign movement in the past. It has some good meanings to it, but it really became this thing to where, as you mentioned, like pain is a universal thing that we're all going to experience, and then how we process it, deal with it, are able to manage with it. I think we get set up in a healthcare system that does not really arm us unless we're fortunate to get in contact with folks like the folks in the Mayo Clinic and others. I'm curious what's been your experience with like the healthcare system, and if you could, you've already alluded to it, I guess a little bit, but I guess maybe my better question would be, what would you think would be if you could wave a magic wand and fix our wonderful healthcare system here in the U.S., and I know some of the healthcare systems across the world share similar difficulties, what would be some things you might do or recommend for healthcare practitioners, maybe just as a practitioner, but also maybe as a system as a whole, that would help folks who are entering the system with some of these complex pain things versus the traditional fix it, and if you don't get fixed, it's you're a treatment failure, which I hate that word, because treatments are failing the patient isn't failing anything. But I'm just curious what you would do to our healthcare system, and maybe recommend to practitioners to help folks who are entering their care that might be walking in shoes similar to yourselves.
Yeah, I actually wrote an article about that, and I think. What's first important is take a minute and listen to us. We're the experts in the pain. We're experts in our pain. I once told a doctor, walk 24/7, live 24/7 in my shoes, in my body. Imagine what it's like. So, listen to our story, and but then guide us and coach us to tell us how we can change the pain. And do what you can. Explain to us number one, explain to us the difference between acute and chronic pain. Never knew that. And, the approach to acute and chronic pain is much different. So explain to us the difference. Do what you can on the acute end. But once that acute end starts transitioning into chronic, then start moving away from the passive interventions to more of the active interventions that we can do to self-manage the pain. And just don't drop us and refer us to another discipline, but work together as disciplines. That's what I loved about the Mayo program, is they incorporated all the different kinds of disciplines in the program, and they talked together and they worked together. And every week we had a meeting. They met every week to talk about each individual, and then we met with that team each week. So, so do that, and then refer us to pain rehabilitation programs. I know there's so few of them, but do that, or a good pain psychologist. And again, that's hard to find as well. But you've alluded to. Don't just keep trying to fix the pain. It's easy to get stuck on that merry-go-round of searching for a cause and a cure.
Yeah, and sometimes just that continuous pursuit, and I think it's motivated by good things. We're all in healthcare, hopefully, to help people, but I think sometimes our pursuit to help and a lack of understanding of pain as a healthcare profession, it still frustrates the heck out of me. And that's probably, again, why we're doing this podcast, is that there's still such a healthcare system full of practitioners who still don't understand pain. I would argue you yourself, Tom, and a lot of the patients I've seen who've navigated pain through a pain rehabilitation program, or maybe just self-taught themselves based on looking at some of the things we now know about persistent pain, the complexity of it, that it's much more than something of a well-meaning physician or pain physician or physiotherapist or occupational, whomever it may be, is going to just fix that. It's just, I think it sets clinicians up for a very frustrating journey, because you feel like, you're just, what you're doing isn't helping. And then unfortunately, then patients get blame laid upon them because they're either not compliant, they're not doing what I'm telling them to do, or there's something that's got to be a patient issue because the things I was trained to do in school no longer it's not helping this person, so it couldn't be me. But maybe it's because what we were trained at in school is very limited way of looking at pain. And that acute pain, as you mentioned, treat it well, manage it when there's clear tissue contributions and clear things that we can intervene with. But then also you need to have those eyes as a clinician to recognize when things are escaping acute pain and things are getting more complex, and being a human starts coming into play, where emotions and identity threatening and all the different, struggles that folks go with start intermingling with some of the nociceptive messages from our tissues. And then some of the things as our nervous system's processing this and the humans processing this becomes a lot more gray and muddy waters that you need a lot of people to help patients navigate that muck and help them kind of move through. I'm curious, Tom, we spoke a little bit before the podcast started. What would you recommend to folks who are maybe navigating this journey and maybe in the midst of it right now and are having a hard time seeing, the ability, the perspective you're able to take looking back? Those folks may not be able to take who are in it right now. What kind of recovery hope would you lend to them as they're going through some of the issues?
Before I answer that, can I make a quick comment about what you just said prior, Mark?
Sure.
It's not the clinician's fault. I mean, I never walked away from a doctor's office feeling like they weren't trying to help me, or a physical therapist, or whatever clinician I was seeing at the time. I never walked away from their office feeling like they weren't trying their best to help me. And it's not their fault. That's what they're taught. And in fact, I think I've seen where doctors and physicians in the United States get something like 11 hours of pain training in medical school. 11 hours. And to your point, Mark, one of the instructors at the Mayo Clinic program told us attendees at the program that we would walk away from that 3-week program knowing more than most doctors do about pain. So I think the education needs to improve. We can't just expect pain to resolve. 15-minute time limit in a doctor's office is not going to change that pain experience. So it needs to go beyond that 15 minutes. And to your point as well, we need to quit focusing on the pain and focusing on the solution. So in terms of recovery for people, there's hope. There's hope. Recovery is possible. You may not be pain-free, but you can live life, and you can live a good quality of life despite the pain. I mean, I still have pain every day. The pain for me is actually just kind of turned into more of an uncomfortable noise, or sometimes I don't even feel it. So, I mean, there is hope for recovery. And Mark, on the dark side of this, on the worst side of it, I mean, I was in pain on that pain scale as high as 9 or 10 some days. I had a 24/7 headache that was excruciating. I was in severe depression. So, I mean, there's hope. There is hope. There is hope beyond it. So.
Yeah, and it's encouraging to see folks like yourself who've obviously navigated things well, and I think the key thing you share is that it isn't a pain-free, but it is sure a existence that is still doing the things in life that bring you joy, that bring you value, that bring you the things that get you excited to get out of bed in the morning. I think that is one of the difficult things when we're working with patients, because again life gets so small and shrinks around the pain to where there's no thoughts about anything valuable. It's just the pain. What's my number? Where's my number? And the pain becomes so front and center with people to the point it's the thought of even doing something of value or different things is just a struggle for folks.
You mentioned about the struggle, and it was a journey for me. Because even after going to the Mayo Clinic program, I thought I knew it all, Mark. I mean, I was doing exceedingly well, but my journey took another turn after about 6 months after the Mayo Clinic program. I was sitting in a chair and I fell, and I hit my head on the concrete at a retail store. It went down. My head hit some metal shelves and landed on. I ended up on the concrete. no major pain at the time, just a little bump. A few days later, I developed a 24/7 headache that never went away. So, and I dealt with that for years. But, and I thought, okay, I have all these skills. Why am I still having this pain? And I went down the same rabbit hole of trying to chase that solution for that pain, biomedically, and blaming the store and the chair for my fall. So it's a journey, that's for sure. There's no easy path to that journey. It's up and down, but it's possible to get there.
Yeah, it's interesting. I've spoken to some other people and seen, patients of mine where some of those past behaviors and mindsets are really easy to rush back into the picture of like how they had previously maybe reacted with anger and frustration and different things. I don't think those propensities necessarily go away. It's just how do we manage them and understand that maybe those thinking processes and emotions aren't really productive to our pain situation. Has that been your experience too, where you felt like you were just slipping back into maybe past behaviors and past thought processes that weren't really maybe moving you in the most ideal direction after you had that second injury?
Well, for first few years afterwards, no, I didn't make that realization. I thought, again, I had pain and I wanted to get it fixed, right? And then I finally came to the realization that it's not going to go away and just magically disappear because a doctor gives me a pill or whatever it may be. So that's when I went to the Mayo Clinic program a second time. I said, I need a reset, and they were kind enough to have me back. For me, after attending the Mayo program, it was like my life just changed. The second time I attended it, my life just changed. And I knew I had to do something different. And I actually tapered off all medications for my pain. I use no medications, I was taking Botox injections for my headache, no longer do that. I do nothing biomedically for my pain treatment.
And that's a scary thought for a lot of folks who, again, I think we get raised on the biomedical model that, oh gosh, if I'm not medicated, where am I going to go? How bad is this thing going to spiral? And I think sometimes the fear is worse than the actual experience. Not to say sometimes it isn't a challenge to wean from some of the medications that folks are taking. And again, there's definitely a time and place. I'm by no means, and I don't prescribe narcotics or anything, so I'm not going to pretend to be an expert in that arena, but having worked with a lot of folks who are navigating that, what was the biggest challenge for you, like mindset wise, when you were trying to get off of the medications? Was it a fear of like, what if the pain gets worse, or what was kind of going through your head as you were kind of considering that and working through the weaning from the medication approach?
Yeah, the fear of the pain is always a driver. I mean, it's a driver every day. Not anymore for me. I know the pain means me no harm. It's just there. I also have tinnitus. It means me no harm. It's there. That tinnitus developed after my fall as well. But so I know it doesn't mean me harm. So I don't fear it anymore. There's no fear at all associated with the pain. It's just pain. It's just there. But yeah, I think what it was for me, and if you would ask me that same question, back in 2016 or 2010, I would be like, no way, you're not taking me off my opioids, or I'm not going to stop taking those antidepressants for that pain. I'm not going to do it. In fact, I wanted to do more. So, yeah, it's just like I said, it's a journey. I'm not sure when that magical shift in my thinking came, but it's just I think what it is, maybe it is just not fearing the pain. The pain means no harm. And I think that's, to me, big, the big message.
Yeah, no, that can be a major mindset shift, because again, I think we're taught, in our culture doesn't really push that type of narrative. It's it needs to be stopped. It represents harm. Something is, and again, that's why you need to consult with a medical professional knowledgeable about pain to make sure we're not. And definitely, if you're considering changing your medication regimen, you want to make sure you consult with your physicians to help you on that, your healthcare professionals to do so. It is a very challenging mindset shift, and it's one that I think consistently I see where folks kind of make space for pain, and it sounds like you've made space for it. It doesn't have to be kicked out of the room, and you have to guard the door to make sure it never returns, but allowing it to be part of your life and focusing on life, like you said. I mean, what are some of the things for you that you've really felt like that were things helpful for your circumstance to focus on versus the pain? Were there any like hobbies or anything that you really kind of focused your attention to kind of get back to the living, or the valued living that you kind of speak of?
Yeah, for me, Mark, I actually retired on disability because of the pain prior attending to the Mayo Clinic for the second time, and I kind of lost sense of purpose. And it's like, what am I doing? What's my purpose here? And so for me, after the Mayo Clinic program, it was important for me to determine a sense of purpose. I mean, I didn't know if I was able to go back to work. I still had questions about that. Am I going to function in a regular 8-hour, 5-day-a-week job? How am I going to function with stress from a team leader, so forth and so on? And I'm thinking, I have all this experience in marketing and writing, and so and working with people. So I decided I'm going to make it my purpose to help others with pain by writing about pain and writing about my experience and the things that have helped me. And so that purpose, I kind of set that purpose up after I left the Mayo program. I started a Facebook group called Chronic Pain Champions, No Whining Allowed. And I did that for a very purposeful reason, no whining allowed, because I had jumped into some other pain groups in the internet, and all I saw was people talking about pain and whining about their pain and complaining about pain. And I very well know that the more attention we give to pain, especially emotional attention, the worse it gets. So, so that's I started my group, No Whining, Chronic Pain Champions, No Whining Allowed. And I said, I need to do more than that. So I wrote a free ebook at the time. And I also started a website resource center called chronicpainchampions.com. And so I just kind of I devoted my energy into that, providing that purpose. Plus also that provided me with a distraction from the pain. So I wasn't just focusing on my pain all the day. In fact, I don't even like to say my pain. It's the pain. I think we need to change how we think about pain. So it's not my pain. So I'm focusing on the pain. I'm not focusing on it. I was distracted. So that distraction and purpose made a big difference in my pain journey.
Yeah, no, and you're doing some amazing work. I think having looked at your website and having seen your I see your conversation sometimes chiming in a little bit on Twitter and other avenues. We'll link to Tom's website in the show notes. Definitely, if anybody here, whether you're a clinician listening to it or a patient who might be going through the struggle themselves, definitely great resources to to check out and hopefully help yourself, help patients on their journeys, or as a patient, maybe navigate your journey a little bit more successfully. You do mention, Tom, the difficulties with support groups online, and I share some of the similar concerns. I'm a firm believer that finding good support is very helpful, especially folks that might have or be walking in the same shoes. It can be very helpful, but then on the flip side, it can be maybe moving us further into despair, charging up our emotions, doing all the things that feed into a pain experience, maybe negatively. So I applaud you for trying to, get a support group out there that is maybe pushing a more adaptable way of managing pain versus a mode of really, again, just kind of feeding in some of the frustrations. Again, all the frustrations are real and understandable for folks that are dealing with it, but sometimes the constant pulling those to the surface, all it does is just bubble that anger and those emotional things that neurobiologically, chemically will change the makeup of your body and change the makeup and experience you have with pain when you're charged emotionally. And again, not that it's completely understandable with some of the terrible journeys that folks go through, but man, some of those support groups can be not maybe the most helpful avenue for folks that are trying to navigate some of these journeys successfully. So thank you for providing a space for folks to maybe get a little bit more of an adaptive, supportive message with that. How many groups have you seen, or what has been your experience kind of with some of those? I know you alluded to some of what you saw, but had you been in a lot of groups like that? I know obviously the Mayo's got a good group where it's a more of an adaptive messaging and role, but what's been your experience with some of the other support groups out there?
The online groups I found horrible. Just in general, most of the online groups, there are a few that I've found to be adaptive and helpful, but most of them by far are not. There's too much attention to the pain. I attended once a support group sponsored by a local hospital here, and that support group had the same rabbit hole thinking with biomedical treatment and complaining and talking about each person's pain. Mark, I don't talk with my family, my friends about the pain I feel. I don't even talk to my doctor anymore about the pain I feel. And when I do talk to the doctor about the pain I feel, it's usually because they ask. And I describe it in non-judgmental and non-emotional ways. I don't need to go down that rabbit hole.
Yeah. And I think that sounds simple, but the way you've reframed pain in your life and the way you even speak to it, the way you refer to it, those are things I know you've learned some great skills in your rehab journey with the Mayo Clinic and probably some of your own studies with it. But it's looking like you're doing an amazing job as far as putting pain in a context that still allows you to do some great things as evidenced by all the great things you're doing online. I want to respect your time today, Tom, and those of us who are listening. Any parting things you'd like to offer to the audience?
There's hope. There's hope. Recovery is possible. I'm living, breathing proof that pain can change. So but it requires a change in thinking about pain. My recovery started when I stopped focusing on the pain, and I changed the way I think about, feel about, and behave in relation to the pain. So there is recovery. I encourage people to find a good pain psychologist, to visit my website, read the books that I have endorsed on my website, to attend a interdisciplinary pain rehabilitation program if they have a chance, because that's what made a difference in my life.
Yeah. And I really appreciate your time today, Tom. Keep doing the great work you're doing. I think we need more folks who have come out of the experience you've come out of successfully sharing their experience. So some of those who are currently going through it can see some of the hope that is out there, because there is hope, but it does take folks finding some skills that aren't easily found out there. Tom's sharing a lot of them on his website, and I would agree, pursue some folks who are versed in the pain psychology field. It's not a hugely populous field of psychologists, but they are out there. Definitely look for pain rehabilitation programs that, as Tom said, are really truly interdisciplinary, are life focused, and getting folks back to life focused, not another program that's here to fix the pain, because that can be a rabbit hole that pulls people back into the mire of this frustrating battle that, unfortunately, we don't always win when it's that battle we're trying to fight. When it's the battle of getting back to life and getting back to things that bring us value and bring us joy, that battle's there to be won. But it's just, we don't live in a society and a healthcare system that puts people in that battle. Unfortunately, we lock people in the battle with that darn number, and it has to be changed for success to be, perceived from a clinician and maybe even sometimes from a patient.
You talked about battle. Stop fighting the pain. Stop fighting it.
Yeah.
A lot of people consider themselves pain warriors. Warriors fight. Battling does no good. It's kind of like, we used to say you battled cancer, right? It doesn't do any good to just keep fighting the pain. It's accepting it and adapting to it, and filling that life, that making that life bigger than the pain.
Yeah. And giving it so much less power. And interesting when those focuses shift towards life, how much pain, as you mentioned, in certain states has gotten much less, nasty. It can be that uncomfortable noise. Sometimes, like you said, not feeling it at every moment, but that's because the focus is shift towards life, not be locked in this battle. So thanks for sharing that, and thanks for sharing your time today. Greatly appreciate it. As I mentioned earlier, we're going to have his Tom's website and the resources linked in the show notes. Definitely check those out. Share them with patients, friends, family, yourself, if you're somebody who's dealing with some difficult pain issues. Hope you found value in today's episode. Don't forget, if you're on YouTube, give us a subscription. That helps us share information like this to others who might be dealing with some persistent pain issues. And until next time, we'll talk to you next week.